As a patient gets further along with their capacity of elevating their arm without the support of either the wall mount or the door mount, then you can be in what's called an open chain. So her arm will be more free to move, but that capacity requires a higher level of support from the shoulder muscles. Again, as we get from 50 to 70, 70 to 90 and above, that rotator cuff has a higher and higher requirement of the muscles of endurance, or the support of endurance. And so, Tracy, I'll ask you to lift your arm. Yep. So use the right arm, the non-involved arm, to support the lift-off in the stages of vulnerability. And then what we want to do is to put this tool over here where it's supporting the weight of her arm, but we're going to work this interval right through here from about 70 to 90 and slightly above, maybe 110. So what the goal is for that rotator cuff to support that arc of motion again. So as she's elevating, we're keeping that rotation true in the joint. So it's partially a gravity-reduced position, but it's also a dynamic requirement that she supports the stability of the arm. Now, Tracy, I'm going to ask you to bend both your knees. Just with the knees bent, it'll give her a little more foundation for her core and for her resultant spine, and that way we can target more of the torso, the freedom, to keep her open. Okay. Now she can also work in different planes and target just a slight stretch in the pectoral area. Try to keep this arm over here where it supports the weight of your arm. That way you're not straining to bring it back. Okay. Is that painful at all?
No.
Okay. Now the other advantage for the therapist is you can do manual work while she's doing that. So targeting the collarbone and the shoulder blade at the same time, just to recognize any other opportunity of merging the joint relationships so that the muscles are getting the isolated influence that they require and not laboring against the patient's body's own impedances to movement. Now another application in this position is, as we recognized earlier, her serratus anterior is weak, and so with the elbow straight, Tracy, what I'll ask you to do is just to lift both your arms towards the ceiling. Okay, so that motion is coming purely from her shoulder blades. Okay, so again, I can help her with that, the shoulder blades. So just rotating them, drawing them into the body. You feel that stretch? Mm-hmm. Okay. Now stay up there, stay up in that position, and then now she could preserve that, and then that way that particular muscle is supporting that new position, and that gives her a cleaner motion at her shoulder joint. You feel the difference?
Yes.